Medicaid expansion bringing hundreds of millions of federal dollars into the state, providing government-funded health coverage for 86,000 low-income Montanans. But questions remain about whether it's worth the cost and politically as well. Mike Dennison reports.
As you walk to the hospital complex of downtown Billings, it's plain to see healthcare is big business in Montana. And with Medicaid expansion, it's gotten even bigger. But is that expansion a net benefit to the citizens of Montana? That's a question that critics and even some supporters of Medicaid expansion in Montana will be asking as the program comes up for renewal in 2019. Republican State Representative Rob Cook was a lead co-sponsor of the 2015 bill that authorized the expansion. He notes the program has greatly reduced the amount of charity care that hospitals used to do for nothing. But Cook says promoters of Medicaid expansion suggested if charity care declined, that healthcare costs for others would level off or decline as well.
I haven't seen a decrease in premium costs yet, and so from my standpoint, it hasn't been successful until we see that. We need to see the cost of health insurance be reduced by this expansion, or it's quite honestly, it's not worth the continuation.
Bullock administration officials say it may be too early to see that effect, and that there are other ways to measure the expansion's success.
This is a way that we can encourage people to stay healthy and save cost over time. How can we not afford it? How can we not afford bringing $800 million of Montana taxpayer dollars back to serve Montanans?
But can the state continue to afford its share? Republican State Representative Greg Hertz of Polson says the state cost could be $200 million in 2020 and 2021, and that's one reason he voted against it.
What happens when we hit fiscal year 19 and we don't have the money, and all of a sudden we have to kick off 80-some thousand people now off of Medicaid?
Yet those who've seen the benefits on the ground of expanded coverage say it's too valuable to just toss aside.
I don't know how you take it away from someone who has maybe had it for the first time in their lives. I don't know how in a country that is this great that you can say some people shouldn't get care.
I think if we can stay the course as a state, we will become a healthier community. And in the long run, it really will save cost. I think we have to really hang in there with this.
Still, to a great extent, the future of Medicaid expansion in Montana is bound to come down to the numbers. At Billings Clinic, the state's largest hospital, patient visits and revenue under Medicaid have doubled, and charity care has declined by $6.5 million. Smaller hospitals have benefited as well, but not all of them. In White Sulphur Springs, Mountain View Medical Center CEO Rob Brandt explains that a number of its current patients switched from a self-insured plan to Medicaid, which pays hospitals at a lesser rate.
When one goes from a self-insured plan to Medicaid, that has a negative impact on us. For Mountain View Medical Center, it has not all been peaches and cream.
Yet Brandt still believes Medicaid expansion has helped the state by covering thousands more people than before. So as you can see, Medicaid expansion is already dramatically altering the healthcare landscape here in Montana for patients and providers, big and small, like here at the Mountain View Medical Center. Of course, that also means any changes in its political future will bring big impacts as well. Reporting from White Sulphur Springs, Mike Dennison, MTN News.